Hey, Dr. Grobe, tilt your camera down a little bit more because your name is cutting off the bottom of your face.
All right, folks are jumping in.
All right. Great. Thanks, everybody. Glad to have you all jumping into the chat.
Anytime.
All right. Cool. Awesome. Nice to have you guys. Thank you so much for joining us. Today, we are talking about anxiety and depression in seniors and how cannabis may help. We want to thank the panelists for joining us, our experts, and Farmacann for creating space and sponsoring this important topic. Please do drop your questions in the chat as they come up, or we can get to them after the discussion. But before we get into the webinar and introduce our expert panel, we want to acknowledge the elephant in the room.
Cannabis has been the subject of so many jokes and stereotypes, and so much propaganda, that it's hard for some people to imagine that marijuana could be a legitimate medical treatment.
Maybe you smoked some pot in college, or tried the brownie your nephew gave you, or you or a loved one may have overused cannabis and can't imagine how it could be medicine. But science tells us that cannabis is indeed just that.
It's impossible to understand that cannabis is medicine without knowing something about the endocannabinoid system.
Like that it exists, for instance. A quick PubMed search yields over 6,000 research studies on the subject.
Problem is, most medical professionals don't study anything about the endocannabinoid system in medical school or continuing education, due in part to the outdated federal policy on cannabis prohibition.
Cannabinoids, the chemical compounds in cannabis and other plants as well, interact with many parts of the body. Until the 1990s, we didn't know how exactly.
Then researchers traced where a THC molecule landed and began to discover that we have a system in our body that regulates all the other systems through chemistry.
The system in the body that interacts with plant cannabinoids was discovered, and then researchers found chemicals that our own bodies make that interact with that same system.
It's called the endocannabinoid system, and the compounds we make in our bodies are called endogenous or endocannabinoids.
The endocannabinoid system is established in scientific literature. Researchers are finding that the endocannabinoid system is involved in balancing nearly every system of the body.
It's interesting that even though the endocannabinoid system is established science, most healthcare professionals don't learn about it and still don't understand how cannabis helps people.
Make sure you ask your doctor if they've studied the endocannabinoid system before you ask them if cannabis medicine is right for you. So that's kind of where we are. And our panelists today are specialists in cannabinoid medicine and experts in elder care with firsthand experience on the front lines in the North Bay area. We appreciate that they're always sharing their knowledge at medical symposia and events like this one. Joining us today to talk about anxiety and depression, Dr. Philip Grobe is a geriatric psychiatrist with 28 years experience. He's a member of the Society of Cannabis Clinicians with an extensive practice in the Santa Rosa and Sacramento area. Thanks for joining us, Dr. Grobe. Geriatric nurse practitioner and president of the American Cannabis Nurses Association, Eloise Theisen, founder of Radicle Health, with clients all over the North Bay and beyond, thanks to telemedicine. And health and wellness director for the Lodge at Fountaingrove and the Terraces Memory Care, Marissa Goldman, LVN, frontliner in the trenches. Thank you guys all so much for joining us. Let's unmute yourselves if you would. And thank you. Let's get into it. So anxiety and depression. Oh, good. Anxiety and depression are among the most common mental health complaints in the United States. According to the National Alliance on Mental Illness, more than 6.5 million older Americans are dealing with depression on some level. In the United States alone, the average rate of depression or anxiety since the start of COVID-19 is over 32%. Isolation depression remains a serious concern for seniors, particularly those living with dementia in care facilities, which are being hit hard by COVID-19. The Alzheimer's Association reports excess deaths in people living with dementia not related to the virus itself, but from the changes designed to protect them that are increasing loneliness, depression, anxiety, isolation, and unprecedented stress. It's been a really challenging time for everyone in the world, but it's fair to say especially hard for our isolated elderly and their partners. Dr. Grobe and Nurse Eloise, you're both geriatric specialists who focus on older people. What are your thoughts in general about how cannabis may help older people struggling with anxiety and depression during the pandemic? Let's start with Dr. Grobe.
Thank you, Chella. Well, I've been working with cannabis for many years now with the individuals that come to me. And it's quite remarkable how many of them have a rather robust immediate response to relief of whatever emotional distress they're going through. Many of these individuals actually don't ask how they have a fairly advanced dementia. And so I will utilize cannabis as in addition to or as an alternative to prescription medications. But I also work with individuals who do either inquire or many, particularly younger individuals, come to me who self-medicate with cannabis. And sadly, many physicians discourage their use, but I try and get a rather clear history of whether it has any therapeutic value, and I'd say a majority of the time it does, and I say that's fine. I support your use of it. But with regard to the older population, the primary impediment to initiating use is lack of education and anxiety due to the public misunderstanding of the potential role of cannabis as a medicine.
Yeah, that seems to be a chorus, right? So, and Eloise, how about you? What are your thoughts?
Well, I think we're starting to see some really good data come out around how CBD in particular can help with anxiety and depression. We're seeing good research to support that the endocannabinoid system plays a significant role in depression, and if you have a dysfunctional endocannabinoid system. So, I agree with Dr. Grobe that often patients are looking to their primary care, physician or other clinicians for advice or potential approval of using it. And often they're met with, sure, that's fine if you want to use it. They really lack that guidance from a knowledgeable healthcare professional that can help them understand what to expect, where to get it. And we also know that the stigma is very much alive and well and can often prevent them from even exploring this type of treatment because of, kind of what the video said and Dr. Grobe said. You end up with these misconceptions, or maybe you had an experience in the past that has led you to feel concerned about moving forward with it. And so really helping them navigate cannabis, I think, can improve their success.
Do you find that it requires quite a lot of education at the beginning?
It depends. It depends on the complexity of their anxiety and depression. When I do a health history, sometimes they're coming to me for maybe chronic pain or insomnia, and I find that anxiety and depression's a comorbidity. We see it occurring, pretty frequently with other health conditions in the older adult. So, it really depends on the severity.
Thank you. Now, Nurse Marissa, tell us how care facilities in like the Lodge and Terraces are working to ease stress for residents and family caregivers who may not be able to show up the way they did normally.
So we've had to get very creative, and one of the biggest selling points for coming into this type of setting is the social interaction that they're able to get. And that can be one of the causes for people to have anxiety and depression in their later years. So In memory care, we have a little bit more flexibility because of their inability to understand the rules that are going on with, social distancing due to the COVID outbreak. But here in the lodge, we've had to do similar to what we're doing right now. You have to do Zoom activities so that at least you're able to see people's faces and feel as though you're having those social interactions. It's a very big challenge for us. We have to completely readjust everything that we're doing, and we have to kind of start from scratch because this isn't something that we're all familiar with. But ultimately, we're really focusing on maintaining good quality of life for our residents, and also just making meaningful activities and continuing to try to maintain social relationships and interactions that can really help them feel like they're getting more out of each day, and able to have those positive things going on a regular basis, despite the fact that we're being so isolated right now.
Yeah. I know that at the Lodge and Terraces at Oakmont, you guys have been using cannabis medicine for many, many years. What are some of the behaviors that are alleviated with cannabis medicine in your experience?
The first time I really saw a huge change was not so much about the behaviors, but in regards to pain management. We see a lot of people that tend to use narcotic pain medicine, such as, Vicodin, Norco, oxycodone, methadone. Those are all very intense medications that are very addictive. So I actually was able to see it I had a resident that that did have dementia and had chronic pain issues, and she was taking Vicodin for a long period of time. Every time she took the Vicodin, she would have increased confusion, higher risk of falling, and was essentially just not able to interact and participate in activities. So we started her on a routine CBD, which made it after a year that she never even used the Vicodin again. And so she was able to, have these meaningful interactions with people, participate in activities, continue to be in social settings without kind of being laconic and just literally just present. And then more so recently, I've seen it work with people that have when we have people with dementia, it's a spectrum similar to autism or anything else. So, they never manifest the same way in each individual. We've had an individual that high functioning, however, very obvious signs of dementia, but high behaviors, very aggressive when it comes to activities of daily living, which is, bathing, dressing, that type of stuff. Very, very resistant to any type of redirection, and angry all the time. And you can see all of these are symptoms of a need that's not being met. So it's really, really challenging for us on the front line to figure out how can we determine what that need is and how can we meet that need and, fix whatever is going on with this individual. We had tried all different types of antipsychotic medications, and I'm personally not a fan of them because they're just counterproductive with individuals with dementia. So we initiated a CBD, and the benefit of the CBD also is not only can you get it in a capsule, you can also get it in, edible form like gummies, which are more appealing to somebody who might have that uncertainty or distrust towards people that they're not familiar with. And so we started this individual on gummies, CBD gummies, a 20-to-1 ratio, and we saw her smile. Almost every day she's smiling, and she would walk around with a grimace and be very upset all the time. And that was really monumental. And again, this is something that you see almost immediately after the first dose. Within a couple hours, you see this change in this individual. And it's very it's very, it makes you feel really good, you know,
Yeah.
that you can actually find something that is not just a crutch, it's something that is actually improving this person's quality of life. Because when you're walking around and you have anxiety, you have depression, you have these behaviors these outbursts, it's because you're not happy. It's because you have all of these other things that are going on, and you're suffering internally.
Yeah.
So it's nice to be able to find something that works well for these individuals.
Yeah. Like you were saying, I mean, we are very lucky in this part of California that there are many different cannabis products available where we are. And gummies are cool, but what makes Farmacann uniquely suited for a facility setting?
Well, in a residential care facility for the elderly, which is what we are, it's called also known as an RCFB. We are mandated by Title 22 regulations, and that's governed by the Department of Social Services. So we have a lot of really strict guidelines. And like I was saying earlier, we're a social model, we're not a medical model. So alternatively to a nursing facility, we do not have 24-hour nursing. I'm the nurse for our whole campus. We don't have often a medical director or a doctor that's on campus. So we need to have medications that are prepared in a way that a med tech, who is an individual with not necessarily any type of background with medications, who's assisting with the administration of these medications. What's great about Farmacann is they package it exactly the way that we need to have it packaged. It's clearly labeled. It comes in a bubble pack, so it's really easy to dispense. It's also easy to be accountable for, because they're treated like a narcotic in our setting. So we keep it in a lockbox. We count them every shift. You minimize the risk for medication errors, which is huge. And what I like about them too is that the dosages are really well dispensed. So like the difference between each of the dosages are really easy to work with. And also they get delivered directly to our community. So we're not having to spend time from our staff or even from the family or significant others to have to go out and get this medication. Because when you have a dosage that's written by a doctor, we have to have it exactly like that. So when you're trying to go run around to different dispensaries to figure out where can I get this one preparation that's exactly the same as what the doctor wrote, and how can I guarantee that I'll be able to get that every single time, it becomes very challenging. And it's nice that Farmacann makes it really, really easy for us. The billing is really easy for the families as well, and it's very reasonably priced. So on all fronts, it's very beneficial to our type of setting.
Awesome. Well, thanks, Farmacann. And thank you, Marissa. So let's talk a little bit about person-centered care. Cannabis Therapeutics is really the epitome of individualized medicine because everyone's endocannabinoid system is different. With medicine shifting to a person-centered care model in the last decade, it seemed that cannabis would be having a shining moment. Cannabis medicine is an excellent tool that could address many symptoms simultaneously. Eloise, how does knowledge of the endocannabinoid system inform person-centered care? How does Radicle Health Education and the American Cannabis Nurses Association teach about the ECS?
That's a great question. Most healthcare professionals are uneducated about the endocannabinoid system, so they're learning about it for the first time. We're also finding that many patients are just learning about the endocannabinoid system for the first time as well. And so at Radicle Health, when I'm working with a patient or their family member for the first time, going through their health history, I'm looking to see what role the endocannabinoid system might be playing in their disease process. So for example, do they have a poor diet? Do they have, do they lack a good support system? Are they exercising? Are they drinking a lot of alcohol? What kind of medications are they taking? What other symptoms are they experiencing outside of the reason they may have come to see me? And that helps me individualize their care and provide patient-centered care, which is quite, I think, unusual in other traditional settings. And it really helps, inform how we want to teach healthcare professionals. Once we identify the endocannabinoid system, whether or not they have a clinical deficiency in their endocannabinoid system, and then moving into the actual cannabinoids in the plant and, looking at those profiles to determine which cannabinoid profile might be most appropriate for that patient. It's, I think for many nurses, at least my experience when I first came to cannabis was I resisted the individual approach of cannabinoid medicine because I was very much used to that, give Norco 3 times a day or take, a statin at night. And that is not how cannabis works. It's quite remarkable to see when we do individualize it, how dramatically different and better the results can be.
Yeah, amazing. It would seem to me that people would be resistant to changing other parts of their life when they're used to getting a pill to fix everything.
Mm-hmm. It is challenging, really kind of assessing their motivation at the beginning to determine what they want to change and starting with one thing at a time.
Mm-hmm.
I think many people see cannabis as a silver bullet. We know it has amazing results, but it can take time to really see those results, and working with somebody again and helping them navigate that process really does improve their success rather than, just trying it once and not being able to monitor those results.
Right. Yeah. Follow-up is so important. Thank you. Dr. Grobe, as we all know, right, every patient is different. How do you find the right dose? Where do you start?
Well, I guess the first issue to address is what are you trying to treat? And that runs the gamut from insidious anxiety, underlying angst that's hard to articulate, just a sense of dis-ease in life, to robust agitation where somebody's potentially going to get hurt. And I adjust my treatment based on what the condition is or conditions are that I'm trying to treat, and also how immediate a response I need to get. So with many individuals, particularly older individuals who are either cannabis naive or had one experience when they were in their 20s or 30s and got very anxious or paranoid and never had since, I do a very gradual approach. And I agree with Eloise, you take a holistic approach. You look at their lifestyle, their diet, what gives them pleasure. And, there was a great study that shows that gardening increases brain-derived neurotrophic factors. So one step is try a little cannabis and gardening, to see. And I bring it with people who are cognitively intact enough to discuss the importance of set and setting. Mm-hmm. That is the intention, the mindset as you take this medicine, with a prayer, for instance, and hope, as well as the setting you take it in. You want to, particularly initially, people who might be anxious to take it first, you want to have it in a calm, soothing setting, perhaps with music they enjoy or some activity, not going out into Costco, for instance. You don't want to do that. And so I usually, people who may be anxious or naive, I typically start with a predominantly CBD treatment, and then I gradually increase THC as needed. Unfortunately, the cost, the limiting factor for most people is cost, and also lack of education. Because I've had several people who I start on a 20-1 CBD THC 2 or 3 times a day, and they don't notice anything. It doesn't work. Okay, it's not that it doesn't work. It's just that you're probably going to need more to see if it works or doesn't work. And then you may introduce more THC to lower the expense, or if expense is an issue, double up the dose of the predominant CBD. So there's that issue. But again, everybody is different. It's not a one-size-fits-all situation.
Yeah. So people need to be patient and keep good notes, or see a practitioner frequently so that they can keep good notes for them. Anxiety and depression are among the most common mental health issues, especially now. And there are published studies and reports among patients that show that cannabis can help ease these symptoms. Dr. Grobe, can you tell us about a very anxious patient living with dementia and their onboarding journey? What symptoms did they have, and how did cannabis ease them?
Right. Well, again, I work with a lot of individuals who, due to the advanced nature of their dementia, are not able to articulate what's bothering them. So the mental status exam is that both of observation as well as of gathering collateral information from people who spend time with this individual. And we always want to address underlying potential triggers, such as anything from pain that's not being addressed to perhaps an undiagnosed urinary tract infection.
Mm-hmm.
So these are things we want to look at, but more often than not, there's no doubt about it that cannabis can help people who have pain, often with insomnia, and also kind of failure to thrive for appetite and weight loss. All these things are often helped, and it's quite unfortunate that many physicians who are prescribing opioids, if they find, particularly methadone, if they find that the person is using cannabis, even if it's recommended by a physician, will no longer work with them with opioids. Again, the lack of education, miseducation. So I have many individuals in nursing facilities, particularly at Primrose and Santa Rosa, who have shown a rather remarkable therapeutic response to cannabis, so much so that I've been able to decrease, if not discontinue, use of allopathic medications like cannabis products.
Wow, that's awesome. Awesome. Eloise, tell us about a patient with anxiety who's benefiting from cannabis medicine. What did their journey look like?
Yeah, it's great to hear from Dr. Grobe as well. I'd love to hear if he's seen some similar experiences between male and females and how they respond to different cannabinoids.
Mm-hmm.
I get some patients as well in assisted living facilities where their behaviors are not well managed with pharmaceuticals, and often are either really aggressive and acting out, or they're crying a lot. And, it's definitely anxiety related.
Mm-hmm.
In some of the patients, in the females, I've noticed that THC seems to be at very, very low dosages the most beneficial for helping with that kind of anxiety that manifests in either crying or aggressiveness. And in males, I've noticed that CBD predominantly tends to be more effective. Now, that's sort of a generalization, but I can think of one woman in particular who was crying all day, every day, just sobbing constantly. And, this was happening before the pandemic, but of course got worse as a result of the isolation. And just a very low dose, 2 milligram THC 3 times a day has stopped her crying. She's actually improved in terms of her mood. So she smiles again. She's more communicative. She responds to activities of daily living better. So she doesn't resist showering or personal hygiene, things like that. So it really can dramatically improve their quality of life, as well as the people around them, their loved ones and the staff.
Yeah, this is a big deal. This is a really big deal. Thank you. Wow. Dr. Grobe, have you noticed changes like that or differences like that in your patient population, or do the men tend to react better to CBD and the women?
I appreciate Eloise's perspective. I haven't noticed a difference, but then again, I just out of my kind of historical way of using it, I tend to start more with CBD, and then, if need be, gradually introduce more THC. The only exception to that would be a situation of where we need to make a change immediately. Somebody who may be violent. In that case, I do introduce a fairly good dose of THC initially, because I find that I need to use more THC for agitated behaviors.
By fairly big dose, what do you mean?
Well, I usually start on a 1-to-1 5 milligram CBD, 5 milligram THC, 2 or 3 times a day, or 2 times a day with an additional as needed dose, just to get a baseline and see. And it's not unusual that I'm able to maintain somebody at that dose. Sometimes you need to push it up, sometimes you need to lower it. Again, all individually based.
Right, right. To a adult use cannabis user, 5 milligrams may not seem to be a lot, but apparently in our population that we're talking about, that is a big dose. So some people might be surprised by that information.
Yeah. I have other people, particularly younger adults, who are much higher doses.
Interesting.
THC are doing great, but I usually don't have to push the dose all that high. I have many people in their family are reluctant to get rid of the prescription medication stuff. So hypothetically, if we withdrew more of this psychotropics, we would need to push the dose.
Right, right. Very good. Thank you. So Marissa, could you tell us a little bit about how anxiety manifests in a facility setting? What does it look like? Is it calling out besides the crying?
Yeah, so similar to what Eloise and Dr. Grove have already mentioned, we see a lot of aggression towards staff or other residents, and sometimes it can be completely unprovoked. We can see, verbal aggression as well, screaming out towards people, and generally just calling out. You hear people just kind of screaming out for, you can't determine why they're actually doing that. Weight loss is another big one, due to decreased appetite or just being so busy that they can't sit down and actually eat, and they're just wandering all the time. Exit seeking. Fear is another big one, and the expression of fear, and delusions, and then sometimes crying about being in fear of people, and distrust towards
Yeah.
individuals. So those are what we usually see at the situation.
And when a resident who has those symptoms and they start using cannabis medicine, and they find the right dose, what does that right dose look like?
The right dose is, when we see that the resident is able to sleep better, that they're able to actually display having a good mood and engage in social activities, and have, more interactions even with their loved ones. They might even stop being aggressive towards staff when it comes to assistance with activities of daily living. And happiness is another big one too, as you just see that their face kind of changes, their affect changes to looking a lot more at peace, as opposed to constantly in fear.
And when they're onboarding, I remember you said that it's almost immediate, like when they first start the new medicine. Do you find that you've had to go through a lot of different dose changes to find the right dose for a lot of patients, or is it pretty easy off the bat?
It really depends on the individual. It's a total case-by-case basis. We do have some individuals that it takes a lot more, trying one thing, see if that works, and easing off of that. And like Dr. Grove said, a lot of these individuals are very reluctant to get off of the psychotropic medications, which can interfere with the effectiveness of the CBD. In my opinion, I feel like you don't get a real image of what it, how effective it really is until you eliminate those psychotropic medications. And sometimes, you see somebody who initiates it and immediately you see a response, like the resident that I had been talking about earlier.
Right. Awesome. That's great. Dr. Grove, back to you. How do you start with someone complaining of depression? Do Do you have a success story of someone struggling with depression getting relief with cannabis therapeutics, and how long did it take for them to find the relief?
Sure. Well, the first question I sometimes ask, one of the first questions, how would you like to proceed? If they're not using anything, I said, well, we could work with prescription medications, or we could work with cannabis to start with. And so, there are some individuals who are have more faith in the medical model that want to go on an antidepressant, and I, of course, honor that request. And then I have other people who say, I don't want to take any medicine. I'd like to more herbal or natural approach, in which case we work with cannabis. And I'd say that the one caveat is if they're suicidal. Of course, if they're suicidal, I go straight to prescription because for a plethora of reasons. But individuals who want to work with cannabis, and I get both their history of cannabis use, as well as their understanding of cannabis. Is there anxiety? Is there enthusiasm? And so all those things go into the equation of where we start and how to proceed. And I always encourage people who are depressed to enter into therapy. It's unfortunate we are such a medically driven society now that we forget about the importance of therapy, in my opinion. But I have one individual that comes to mind who came to my office, and who was he's a very successful individual, has a lot of world experiences, quite capable, but slowly in a state of cognitive decline, and there's a sense of that, but not a clear appreciation. And I think that cognitive decline has clearly contributed to his sense of dis-ease and loss of place in the world. So he had like an agitated depression, where he would just snap and become irritable and fly off the cuff, and was traumatizing to his loved ones. And we started him with a CBD, a 20-to-1, a CBD to THC 2 or 3 times a day. And he comes back and says, I feel fantastic. I feel so much better now. So even though he was not able to come to me and say, I'm really depressed, my sense was he had depression going on, depression, agita. And lo and behold, and the interesting thing about cannabis, as Marissa stated, you often see the response right away, as opposed to, say, an antidepressant, where oftentimes you have to wait some weeks to see the response.
Yeah, that's a big deal. That's a really big deal. Thank you. And Eloise, what have you found in treating elderly complaining of depression using cannabis medicine?
Yeah, and I also appreciate Dr. Grobe's approach, because often there are many factors that we're trying to evaluate and consider when coming up with a plan, and often they may not even be fully aware that their symptoms are related to depression. I can think of one older woman in particular who was wanting to use cannabis for depression, and we, after doing a thorough health history, decided on a THC approach. And she came back to me and said not only has her mood improved, but that she's actually able to work through some very tough things for her. It helped open her mind. It helped her feel more accepting of some of the things that she felt like she was working through those things differently. It's almost like it gave her permission to dive in deeper to what was really causing that depression, and lowered her fear around that. So she was able to do that work. And, she just came back beaming when she saw me. It was really a dramatic effect that she received almost immediately as well. And it really helped me to understand the importance of educating around euphoria that people tend to be very afraid of with THC in particular, and how healing that can be for many, many people, especially when they're dealing with chronic and age-related illness. That euphoria can be a very welcomed benefit.
Definitely. Oh, definitely. And how about you, Marissa? What have you seen in the facility setting with folks struggling with depression during the pandemic?
Well, similar, to what all of us have kind of been going through is it's just that limitation of being able to see people that you really care about and love, that you're familiar with, that it causes them to have a lot of more of a decline as well. And I think a lot of that has to do with the limitation of having those really meaningful, positive experiences. And so a lot of people I've seen, even in my lodge setting, have turned to cannabis to work through some of that. Because they are feeling more depressed, they are feeling more anxious, more isolated, and it's a very challenging thing for especially our older population to go through, because this is when you spend a lot of your time kind of reflecting on what's going on with your life, and the limitations that you're facing, the loss of control that you're facing, and to remove people that bring you meaning and bring you happiness can really be detrimental. So the benefit of having something like cannabis, and I love that Eloise had touched on the euphoria aspect, is because that can really assist them in working through some of those feelings that they're having, and empower them to take back control over their own emotions, and really make for a better situation for them.
And maybe have a little joy in life.
Exactly.
Goodness gracious, joy is always good, right?
Yeah, that's what keeps us going,
Yes. Well, we are getting toward the end of our time together. I'd love it if you would each give us a little bit of a wrap up of your thoughts. It's been so great talking with you all. We really, really appreciate each of your perspectives. They're so unique and different. Is there anything you'd like to add? And also, please tell people how they can connect with you and your organization. And I know Eloise is presenting at a conference soon, so I hope she'll tell us about that. Maybe start with Dr. Grobe real quick.
Thank you. Well, I'm always pleased to be able to talk about the potential value of cannabis and helping people journey through life. It's not for everyone, but I think it's quite unfortunate that there's been this public campaign where it's still considered a Schedule I substance of no therapeutic value. So hopefully in my lifetime, this will change, along with other Schedule I substances, which actually have remarkable potential as healing vehicles. So if I encourage people to get educated, there's a wealth of information on the internet, and if they'd like to reach me, they can. The best way would be my email, which is yaladdrala@gmail.com.
Excellent. Thank you, Dr. Grobe. And Eloise, how about you?
Yes. Well, thank you for bringing us all together, Chella. I think you did a fantastic job.
Oh, it's my pleasure.
Raising awareness around this topic, and, working with older adults. I love getting an opportunity to really help them with cannabis. I feel like it's sometimes the only thing that works for them, and sometimes it doesn't work for them at all, like Dr. Grobe said. So just being able to have that opportunity is such a treat. I will be presenting at CanMed in September of this year. Some of the data on my patients, my Alzheimer's dementia patients who've been using cannabis successfully to manage their symptoms, reduce their pharmaceutical intake, improve outcomes. So I really look forward to that. And you can go to my website at radiclehealthcare.com. It's RADICLE, like the root that comes out of the seed. And you can learn more about me there, the education we're providing, and how to book an appointment.
Awesome. Thank you. And Marissa, how about you?
Thank you so much for bringing us all together. It's been a lot of fun to, talk about this with you guys. So the best way to get in touch with me is my email, Marissa, Marissa, Goldman, Goldman, at oakmontmg.com. And, it's been quite a journey, and our goal here at the Terraces Memory Care and the Lodge has been to really reduce the use of psychotropic and antipsychotic medications with our elderly population. We've taken a lot of strides to do that. In the past 6 months, we've gone from 40% usage to down to 16%. So we've made, tremendous effort, and we've also had a lot of success with it. And it's a holistic approach completely. It's the assistance with CBD medications, but also just about programming and how you're able to find meaning in people's lives, and also find other venues to help with people that are having those really challenging moments in their day. So it's been a lot of fun, and we've worked a lot in trying to do a multi-sensory room, also known as a snoozlin room. So that's been a big driving factor as well. And I am really proud of my team here. It's been a lot of education, and Dr. Grove, we've actually worked with him a lot with our residents as well, and he's a great asset and assistance with that. So
Cool.
Thank you so much.
That's great. Thank you all. Do we have any questions from our audience? I know we have a little audience today. It doesn't look like we have any questions, but maybe we can inspire some questions. Efren, or I know Efren, it would be great to have a question from you, Efren. I know you've got something to say. Or Danny Mendel.
Someone on YouTube wants to know.
Oh, someone on YouTube wants to know.
Is there a chance of cannabis leading to psychosis?
Oh, that's a great question. Is there a chance of cannabis leading to psychosis? Dr. Grove, would you mind taking that question first?
Okay, so most definitely. You can see paranoia, particularly triggered by THC. In fact, the research, my reading of the literature suggests that THC has the potential for inducing a psychotic state versus CBD, which is actually being studied now as an antipsychotic and used in treating people who have schizophrenia. Unfortunately, the doses that I've seen that show efficacy on par with antipsychotics are unaffordable to the majority of people.
In the studies that you've read about THC, were they the low doses that we're talking about today?
I don't recall the exact dose, but I can tell you just through my observation over the years is that even a low dose can make people feel somewhat paranoid, maybe not a frank delusion, although you can, THC can be a psychotomimetic. It can create a psychotic state, and that's another reason why I believe in the dictum: start low and go slow. And particularly in working with people who are older, whose metabolism is not as robust as a younger individual.
And how about you, Eloise? What have you found, or what do you know about the potential of cannabis causing psychosis?
Yeah, there's always potential for it. There's plenty of case studies where we still haven't been able to identify at what dose we're seeing that. We have had a lot of reports come out of states that legalize cannabis where there's increased potency of THC. We've also seen it with synthetic cannabinoids, which tend to attach to the receptors differently than the phytocannabinoids. So there's always potential there. And I think people need to be really careful when they're using it, especially if they have a family history of any sort of, psychosis or schizophrenia.
We have a question that just came up in the chat that goes right on the tail of that, a good follow-up. If you have a patient, from Megan, if you have a patient that has a family history of schizophrenia, do you steer away from cannabis completely? Eloise, or Dr. Grove?
Eloise, you take it.
I want to hear from both of you. I do want to hear from both of you. So whoever wants to go first.
Well, let me say this.
It depends, right?
I don't think we need to medicalize cannabis. I think people who have autonomy should be free to use cannabis. Not everybody needs to go to a healthcare practitioner and get guidance. But with that said, in somebody with this history that's interested, it might be a good idea to work with somebody like Eloise or myself. I would say, no, don't steer clear, but be mindful of the potential, as we all should be, even without a family history.
Yeah, I love that response. Correlation doesn't mean causation, and a good thorough health history will help you identify risks.
Great. Okay, I have another question. Oop, it disappeared. Dave's showing me another question from YouTube. Does anyone know if there's a doctor within Kaiser? Is that the question you?
Yeah.
Oh,
Kaiser.
Does anyone know if there's a doctor within Kaiser Permanente who works with cannabis for depression, or someone in Los Angeles?
You know about Kaiser.
I do. I know about Kaiser. Do you know about Kaiser, y'all?
Kaiser is like one of the hardest entities to work with. They're so against cannabis use. Most cases that I found with my residents here, because in the North Bay, Kaiser is very big. The doctors won't even touch it. They won't even advise it. They completely steer against it. So they end up having to actually go with, private pay if their families are really interested in doing that. Right. And sometimes the doctors in Kaiser won't even want to continue to work with that person, depending on if they're deciding to take that venue. So it is a bit of a challenge because Western medicine isn't keeping up with any type of holistic approach for the most part. And especially in the Kaiser system, it becomes a huge challenge for us, especially because I want to say, at least 50 to 55% of our residents are on Kaiser. We have people that would benefit from using cannabis, but because they're in that Kaiser system, they won't even have the opportunity to try it to see if it improves their quality of life. So it is a huge challenge. I think that it depends on which Kaiser you're in, and it depends on the doctor, but I have not had any luck. So that's just my experience.
And Eloise?
Same. I mean, I my understanding is that they have issued a statement within the organization that says they don't support cannabis use. I do have some individual Kaiser physicians that find a way to get my information to their patients so that they can explore it, but they won't propose it.
Right. And Dr. Grobe, same?
Yeah, the physician's hands are tied, and even those that may be comfortable can't because they're part of the Kaiser establishment. And it's a catch-22 because Kaiser, like many establishments, say, oh, we need more research data, right? And then there's the whole Schedule 1 issue. But to date, as far as I know, there's one source for federal allotment of cannabis, which is out of Mississippi. So, it's same old, same old.
Yeah, that's true. In my experience in Kaiser in Los Angeles, also the same. They don't deal with it. There was a directive issued that they don't talk about it. But when I was working with my dear friend of the family who had dementia, I did bring Dr. Ethan Russo's review article from Frontiers in Integrative Neuroscience about cannabis therapeutics and the future of neurology. I was compelled. I had to.
Thank you for answering that question, and she has a follow-up statement there.
Okay, Robin gets it. Okay, so a follow-up. Marissa, UCLA reported me when I asked for cannabis for my mom with dementia. I asked who was doing research at UCLA. They got very angry. Is that the follow-up?
Yeah, that was the lady who asked
Oh,
about
okay.
Kaiser.
Yeah, so I have experience with UCLA and dementia, but we were not reported. We had a really good doctor who's no longer there, but she was vegan. It's really hard in these systems. And at UCLA, they have a whole research arm about this, but it's the way we got into it was through CanMed at UCLA at a very interesting panel on how cannabis helps dementia. That was very, I met a lot of really great people in the audience. Let's put it that way. It was very exciting to be there. And as far as doctors in Los Angeles, you can find referrals to doctors in Los Angeles at the Society of Cannabis Clinicians website. Dr. Sherry Yafai is one of the board members of the Society of Cannabis Clinicians and also appeared on our podcast, Cannabis Helps Dementia. You can check her out there as well as at the Relief Institute. But also our panelists do telemedicine. I know Eloise does telemedicine, so you can consult with Eloise as well if you needed some direction. And I think Dr. Grobe does telemedicine as well, right, Dr. Grobe?
Sure.
Yeah, okay. So there's that. Okay, I have another question from YouTube. Can you let us know beginning dosages and type of tincture to buy if we don't have a doctor? No. Pretty much
I mean,
no.
you know, I recognize that the cost of seeing a clinician out of pocket and paying for the medication is challenging, but you know, it depends is always my answer. And without, you know, there's so many factors to consider. Without that information, it would be inappropriate for me to make a recommendation.
Yeah, I would add is, you know, my understanding is that bud tenders can be very helpful. They're very knowledgeable of the products. You know, there should be a breakdown analysis of the product. So you want to get a good source, a company that has a good reputation, ideally organic, right?
Like Farmacann.
And yeah, you know, but as far as starting doses, we really can't make that recommendation other than to say, you know, it's wise to start gradual. Now, I believe that, remind me of the name of the doc up in Maine who has a website, healer.com. I think he actually discussed starting doses. So that may be a good resource for this individual.
So healer.com is a great resource also for free education. And Dr. Sulak is the one who runs healer.com. He also takes telemedicine patients and is a board member of the Society of Cannabis Clinicians. So if you have any questions for, you know, healthcare practitioners, those are great resources, as well as the American Cannabis Nurses Association and Radicle Health. Radicle Health has a community ongoing education as well. So, you know, cannabis does work best with education. Another great resource is projectcbd.org. Yeah, I mean, I guess if we don't have any other questions, I think that wraps us up, right? So we want to thank Farmacann. We want to thank you, Dr. Grobe, and Nurse Practitioner Eloise, and Nurse Marissa for doing all you do for older people. And we want to thank all of you for watching and sharing, and thank Farmacann for making it a priority to get this medicine to people in assisted livings in the North Bay area. Go to farmacann.com to learn more. And we thank you all, and we hope to see you again.
Awesome.
Cool.
Thank you.
Thanks. Thank you, Shella. Bye, everybody. Nice to meet you.
Bye.
Bye. Thank you.
Thank you so much.